Vitamin D is one of the most talked about nutrients in the world right now, and yet over 1 billion people worldwide are deficient in it, including people who live in sunny countries, including people who eat healthy, including people who take supplements. Here is the shocking part. Most of them have no idea, because vitamin D deficiency has no obvious symptoms in the early stages. It hides. It mimics other conditions, and most standard blood panels do not even test for it properly. By the end of this video you will know exactly what vitamin D deficiency looks like, what the clinical warning signs are, what blood tests to ask for specifically, and what the research says about fixing it. Stay with me, because the last insight about vitamin D is one that most doctors do not have time to explain in a 10-minute appointment. Here is why vitamin D deficiency is so easy to miss. The symptoms are vague. They feel like everyday life. You feel tired all the time, but you blame your busy schedule. Your bones and joints ache, but you blame aging or sitting at a desk. You feel low in mood, but you blame stress. You keep getting sick, but you blame the weather. None of these symptoms point clearly to vitamin D deficiency. They could be caused by dozens of different things. And here is what makes it worse. Most people who get a standard blood test never get their vitamin D checked. Their doctor checks cholesterol, blood sugar, kidney function, but vitamin D often gets left off unless you specifically ask for it. So people walk around for years, sometimes decades, with low vitamin D, and never know it. The consequences of ignoring this are serious, and the research is very clear about that. First, let us understand what vitamin D actually is, and what it does in your body. Despite being called a vitamin, vitamin D is actually a hormone. Your body produces it when your skin is exposed to ultraviolet B rays from sunlight. But here is the thing, the vitamin D produced in your skin is not active yet. It travels to your liver first, where it gets converted into a storage form. Then it travels to your kidneys, where it gets converted into the active hormone form that your body actually uses. This active form of vitamin D, called calcitriol, does an extraordinary number of things in your body. It regulates calcium and phosphorus absorption in your gut, which is critical for bone density and strength. It modulates your immune system, helping it fight infections without overreacting and causing inflammation. It supports muscle function, which is why deficiency causes weakness and pain. It influences mood regulation through its effect on serotonin production, and emerging research shows it plays a role in insulin sensitivity, cardiovascular health, and even cancer prevention. Vitamin D receptors are found in almost every cell in your body. This is not a minor nutrient. This is a critical hormone. Now here is where it gets important from a clinical perspective. There are 2 vitamin D tests available. Most doctors order the wrong one. The test you want is called 25-hydroxyvitamin D, also written as 2,5-OHD or calcidiol. This measures your body's storage form of vitamin D and gives the most accurate picture of your overall vitamin D status. The other test, 1,25-dihydroxyvitamin D, measures the active form. This is often normal even when you are deficient because your body tightly regulates active vitamin D levels. So this test can miss deficiency completely. Always ask specifically for the 2,5-OHD test. Now, what are the normal ranges? This is where clinical guidelines differ from what many labs report as normal. Most labs report anything above 20 nanograms per milliliter as sufficient. But clinical research increasingly shows that optimal health outcomes, particularly for immune function, bone density, and mood, are associated with levels between 40 and 60 nanograms per milliliter. So you could have a result that your lab flags as normal, but your levels are still too low for optimal function. Ask your doctor not just whether your result is normal, but what your actual number is. Certain groups of people are at significantly higher risk of vitamin D deficiency. People with darker skin tones. Melanin, the pigment that gives skin its color, reduces the skin's ability to produce vitamin D from sunlight. People with very dark skin may need up to 10 times more sun exposure than people with very light skin to produce the same amount of vitamin D. People who spend most of their time indoors. Office workers, students, people in care homes, anyone who gets limited sun exposure is at high risk. People living far from the equator. The angle of sunlight in countries far from the equator means UVB rays are too weak for vitamin D production for large parts of the year. Older adults. As we age, our skin becomes less efficient at producing vitamin D from sunlight. A 70-year-old produces approximately 4 times less vitamin D from the same sun exposure as a 20-year-old. Obese individuals. Vitamin D is fat-soluble, meaning it gets stored in fat tissue. In people with higher body fat, more vitamin D gets sequestered in fat cells and is unavailable for use by the rest of the body. People with conditions affecting fat absorption, like Crohn's disease, celiac disease, or cystic fibrosis, because vitamin D requires fat to be absorbed properly from food. Here are the 3 things I want you to remember from this video. Insight 1. Ask for the right test. Always request the 250-HD test specifically. Do not accept a result without knowing your actual number. Normal on a lab report does not always mean optimal for your health. Insight 2. Sun exposure alone is often not enough. Depending on where you live, your skin tone, your age, and how much time you spend outdoors, supplementation may be necessary. But always test before you supplement so you know your baseline and can track whether supplementation is actually working. Insight 3. Vitamin D works in partnership with other nutrients. Vitamin D needs magnesium to be converted into its active form. It needs vitamin K2 to direct calcium to bones rather than arteries. Taking vitamin D alone without considering these cofactors is an incomplete approach that many supplement recommendations miss entirely. If this video explains something about your health that your doctor never had time to go through properly, subscribe to Nourish and Know. Every week we go deeper than the surface on nutrition science that actually matters for your body. Real mechanisms, real research, nothing left out.